What's up guys, my name is Jin, I'm a physical therapist, and today I'll be going over how we can effectively rehab frozen shoulder. I'll be going over some of the exercises here at my clinic that you can start doing immediately at home. But if this is your first time on my channel, welcome. Be sure to check out my channel and subscribe if this is the type of content that you are interested in. So frozen shoulder, also known as adhesive capsulitis, is one of the most common diagnoses that I treat here at my clinic. The shoulder capsule tends to thicken and tighten over time, which freezes the shoulder. That stiffness in the shoulder causes inflammation, and that gradual onset of pain is usually very common with frozen shoulder. A lot of my frozen shoulder folks actually present with some difficulty reaching, whether that's overhead or out to the side, taking their clothes off and on, and also some night pain, so they have a lot of difficulty sleeping at night. Unfortunately, frozen shoulder takes some time to heal. It goes through 3 stages of rehab. The freezing stage, where the inflammation begins to happen, the frozen stage, where you see the range of motion most limited in, and then finally the thawing phase, where things start to get back to normal. So patients tend to experience these 3 stages in the span of a couple months, but it can also take up to 2 years. The good news is we can try to accelerate that process with what we do here in physical therapy. So there are lots of ways to treat a frozen shoulder. Some joint mobilization techniques, exercises, stretching, manual therapy. But in this video, we'll specifically focus on exercises. All right, so these first set of exercises, we're gonna be using a dowel. If you have a dowel at home or a broom that you can use, we're gonna try to take advantage of this thing and try to increase that flexion range of motion, that abduction range of motion out to the side, and some external rotation range of motion. So I'll show you the flexion exercise first. This one, we're gonna go ahead and have the dowel in front of us, and we're gonna try to bring it over our head as much as we can, and then bring it back. If it causes too much pain to go all the way over your head, be sure to go up to the point of pain, and then you can come on back. Let's try to repeat this for 8 times, and then we'll go for 3 sets here. So 3 sets of 8. The next one I wanted to show you is working the abduction range of motion. So with this one, you're gonna go ahead and let's just say the right shoulder is what's bothering us. We're gonna try to increase that right shoulder abduction range of motion here. So we're gonna go ahead and hold on to the end of the stick or the dowel with our left hand, and then with our right hand, we're gonna try to go up, out to the side as much as we can. And then come on back, out to the side again, and then come on back. Same thing here. Let's try to repeat this for 8 times and go for 3 sets of 8. The last exercise I want to show you is with both hands, palms facing up. We're going to try to improve that right shoulder external range of motion, external rotation range of motion. So we're going to go ahead and use the left hand here to push that right hand and right shoulder to the external rotation range. There, just like that. You might feel some stretch in the front of the shoulder, and that's okay. Let's try to go for 8 reps here as well. So 3 sets of 8 for all those range of motion exercises would be a very good start and a very good warm-up. All right, so the second exercise that I want to show you guys is called arm circles. There's 2 ways to go about this, and it's usually for folks that experienced a little too much pain during the dowel exercises that I just shared with you. So it's a more gentle way to introduce that range of motion. The first way to do this exercise is by just finding a bed or a table, and then we're going to go ahead and let that arm hang down, let the gravity take it, and that gives it a little bit of a distraction there. And we're going to go ahead and draw circles 10 times clockwise, and once you're done with that, we're going to switch and go the other way counterclockwise 10 times. All right, so try to go for 2 sets of 10 with these exercise. And then there's another way to do this one where we introduce some shoulder stability here as well. So we're going to go ahead and find the ball. Any ball would work. Go against a wall and then draw circles that way with the ball in your hand. That gives it a little bit more stability, and it also allows us to work on some isometric strength as well. So same thing here, we're going to go for 10 times clockwise and then 10 times counterclockwise and go for 2 sets. Okay, exercise number 3, we're going to call this one door frame exercises. It's very good for mobility, but also getting some good stretch in your shoulder would be very beneficial for you. So the first way to do this is by hanging on to a door frame. Hopefully you have a better grasp at your door frame than I do. This is not really a door frame, but we're just going to use this as an example for today. We're going to grab it and then go ahead and lean back, almost sagging your hip, and let gravity take you. Don't fall though. We're going to try to repeat this for 8 times, so going for 2 sets of 8 would be very good here. Another variation for door frame exercises is having your fist up against the wall here, and then we're going to go ahead and turn the other way while keeping your elbow nicely tucked in, and then having it at 90 degrees is very important. And then go ahead and rotate out and walk out the other way, and then back in. We'll repeat this one for 8 times as well, so going for 2 sets of 8 with the flexion exercise, and then the external rotation exercise will be exercise number 3. Alright, so up to this point we've worked on that shoulder mobility, increasing that range of motion with less and less pain. But if you feel like you're up to the point where you can work on building up some strength, this would be a really good exercise. We're going to go ahead and find a ball, go against the wall, and then rotate your fist in towards you while keeping your elbow tucked in nicely. So we're going to go ahead and turn it towards you and back. Towards you and then back. We're going to repeat this for 10 times. Let's try to shoot for 3 sets of 10. And when you're done with that, we can go ahead and switch. This time having the ball and the outside of your hand against each other. And we're going to push out this time. So out and back in. Out and back in. Try to engage those external rotators. Out and back in. And we'll repeat this for 10 times as well, so 3 sets of 10. Obviously, I'm not saying you should do this every day, all these exercises every day, but I just gave you some good options to pick and choose from. I hope this video was helpful. Thank you guys for watching, and I'll see you guys next week. Bye.